Hello. I Hello everyone. I'm here with Paul Ritchie, here with the latest installment for Allegheny Independent Media. I'm interviewing Amber Urish. Did I say your name right?
You did. Yeah.
Okay, for yes, she works for what the Community Action of Blair County and Cambria County.
Blair County Community Action Partnership. We serve 9 counties,
Oh,
um, but we are in charge of the pick count for Cambria and Blair.
okay. So yes, in January they did a census of the homeless in Blair and Cambria County, and she's here to talk about the results. Um, okay, so I guess I will let her discuss. You said last year you had 41.
Yes, that included sheltered count. We have sometime during COVID we had hotel funding vouchers. We don't those funds are really low right now. We don't really have those anymore, but during pick count we did. So that included the sheltered and unsheltered count.
Okay, so what did you find for Blair County this year?
So this year we found 10. Again, it was really cold. We had the snow and ice storm.
Yeah.
Um, a lot of them, we go out between the hours of 6 and 9 p.m. A
Hmm.
lot of them might have still been sitting at sheets or inside somewhere. And we do go to those places, but it's a little bit more tricky to tell who is homeless,
Yeah.
not sitting there with a sign above their head. Um,
Hmm.
so we did the best we could there, and there were barriers as to the roads that we could access and everything. We got 10 unsheltered in Blair. 25 were in a hotel through our agency with our funding. In Cambria, we couldn't find any. There's a lot of reasons why we don't find any in Cambria. A lot of them stay in abandoned houses that aren't safe for us to go into. Uh,
Hmm.
a lot of them don't like to be found. And I can discuss that more in the data that we have with in our coordinated entry system. And again, it's up the mountain in Cambria, and the snow and ice was significantly worse. And for the safety of our volunteers, we couldn't make them go into some of the more rural areas.
Okay. Well, certainly, yes. I realize these getting reliable numbers for these populations is difficult. So, certainly these numbers, they are highly correlated with poverty and income estimates. Okay, I can share the screen and show you, like, do you use county health rankings, like rely on their numbers at all?
We might, that might be more of like the grant funders that do that. I'm the pick count coordinator and the coordinated entry specialist. I'm kind of the frontline person. I'm the only specialist in Blair County and Cambria County. Um,
Okay, well, I can show you with their numbers and like, yeah, they do, they track like use over like 60 health statistics, cultural statistics, economic, environmental statistics. So yes, I could show you that real quick. So, and okay, let me see here. All right, yes, this is for Blair County. So, like here, they have like estimates of children in poverty. This is one of the. So yes, yes, you can see like these are the estimates.
mhm.
Certainly, children in poverty is highly correlated with adult poverty as well. So yes, you can see yes, this a discrepancy in Blair County for along racial lines, and you can see like how let me minimize. Okay, and so here you can see like how Blair County, yes, there was a spike in child poverty in 2019, and it did seem to decrease in 2020. Coming back down to more like similar to what you would see in Pennsylvania and the U.S. Um, so,
I
so
think there's
yeah.
a strong correlation with Blair County. It's a very weird county because Altoona is a very different type of city. It seems very rural, but it still has the city aspects.
Hmm.
A lot of people come here because they feel like the price of living is a lot lower than the urban areas, which it's true. But again, we're rural, so there's not much housing.
Yeah.
It's kind of that middle part where that's why the pig count's so important to show HUD like how much of a need
Yeah.
our county actually has, even though we're more rural.
Yeah, well, plus the government was, this was 2020. That's when the pandemic was going on, and there were some stimulus money being given to residents. So that helps too. And let's see here. Down here, I do have, well, median household income. Yes, yes. Well, median household income for Blair County is lower than it is for the state and the US. So, like the median, if you rank all the incomes from highest to lowest,
Right.
and then you can see, yes, along racial lines all the way down to 29,000 for African Americans and 36 for Hispanics. And I can show you what it looks like for Cambria County. Yes, I mean, so yes, the trend certainly was much higher for, say from 2016 to 2019, there was a higher rate of child poverty in Cambria County. And yes, a lot of this is within the city limits of Johnstown. So, but then, there was also a decrease in 2020 due to housing, due to the stimulus. So,
I would love to see what that would be like between 2020 and now 2023, because there was a big, we did have a lot of assistance and a lot of the people with the stimulus. There's also ERAP. There was also a lot of that stuff going on. That all kind of has dwindled out. And even the food stamps that are going back down to normal rates. It's again, because I'm the specialist, I'm the first hand person. If you're homeless, the person you're going to call is me. And
yeah,
that's what I'm seeing. And the rates of the calls are just skyrocketing because all of that assistance now is just not there anymore.
yeah. So, yeah, and of course, yes, there are up looming cuts in Medicaid and food stamps coming as well, sadly. So yes, I mean we can see that and say for median income is low. So the median income is lower for Cambria County than it is for Blair, like about $4,000. So yes, Asians do very well. I mean African Americans, Hispanics, well. So yes, I mean I just wanted to show you some of these numbers and let you comment on them. The rankings for 2023, they should be out in the next few months. So,
That
so
would be
yes.
interesting to see. A lot of the funding that we had in the mass amount, um, it just wasn't enough like to do a lot of case management with it. It didn't allow for it.
Mhm.
Now our funding that we have now, there's case management involved. The pandemic funding, it was kind of released very quickly,
Mhm.
which was needed, and as much case management as the funding allowed, we did. But I think that without that case management, a lot of people weren't able to self-sustain and now are reaching out for programs that have the case management, and we're able to then, it's going to take time. The poverty level I think went down in 2020. I think that you're going to see it go up in 2023 and then steadily decline from there when we can get this case management. A lot of,
Yeah.
and especially in Blair County, the collaboratives of agencies, and we're really working together now to see what we can do on all levels to try to, at every aspect, mental health
Mhm.
and drug and alcohol, we're all kind of working as a team and really trying to see what we can do to make
Mhm.
this better.
So are there a lot of active homeless shelters, say in Blair County and Cambria County?
Cambria County has one that is run by a charity. That's the Martha and Mary House.
Yes.
I did reach out to them during pit count to try to get their sheltered numbers if they report any to HUD. Now, again, you're not required to if you don't have HUD funding. I don't know what kind of funding they have, but I wasn't really able to get an estimate on that. We do have a shelter here in Blair County. We just opened up a new one. There's, I think, 30, a little over 30 beds. There's family units, and then men's and women's. It's a very, very nice facility that just recently opened up. During pit count, they just had their old family shelter, which is a little up the street. I think they had, I don't know for sure. I think it was around 12 people in the night of pit count. But now they're able to serve a lot more, which is good. But again, 30 beds, it will help a lot of people, but there's a lot of people that need help in Blair County.
Yeah, I knew there was another like a mission in Cambria City in Johnstown for the homeless.
I know
Uh,
that's Martha and Mary. I don't know about a mission. It might be Altoona Rescue Mission.
okay.
Well, no,
Yeah.
American Rescue Workers, I'm sorry.
Okay. So you basically use volunteers to go out and do the census and
Yeah, in Cambria, we had 32, and in Blair, we had 47. And again, that was combined volunteers of homeless providers, service providers, local churches, VA, drug and alcohol. There was people that had lived experience with homelessness, and they all kind of came out even during the storm and tried to help us.
and it's all done in January of every year.
Yes, it's the same day every year for it's across the nation, and it has to be done that night.
Okay. Yeah, sometimes you could argue it might be easier to do in the summertime.
We've had the conversations. Um, I'm not exactly sure why we do it in the winter. I think that it's easier to count the number of homeless people in the winter because if
Yeah,
you,
when they're out, if they're out on the street, yeah.
yeah, someone's out on the street, they're gonna be homeless. We were able to get enough donations where we could supply everyone that we encountered with cool weather sleeping bags that will keep someone comfortable up to -10 degrees. Especially in these rural counties, a lot of people camp out, so we were able to supply tents, book bags full of toiletries, winter wear, and food. And we were able to have enough of that to then give to a drop-in center where they hang out during the day so that people can go there and still have some here. People come in here now, and we're going to keep that stocked to try to serve everybody, at
So,
least do something.
so the Blair County Community Action, you said you also serve 9 counties.
Yes.
So, so yeah, so yes, so do you have offices in these other counties or they
We
have to
do not.
contact? So they have to contact you by phone from those counties.
We do, if they are being served in those counties, they will still get their monthly visits to their house. The case managers will drive there. They'll still, we'll still have to, um, sorry, we'll still have to go do inspections on the places and everything. Everything that we would see people in office here for, we will go out there for.
Hmm. And I suppose, I guess, I'm sure a lot of it can be that, they can fall prey to victims of crime and drug
Yes,
abuse.
yes, that's a lot that we see. We do have a program. Actually, there's another UPMC program starting out, but the one that we have now, which is in partnership with Blair Drug and Alcohol and Blair Health Choices, which assists people with a mental health diagnosis and drug and alcohol. And if they are being able to be assisted by us, they come up on our list and they qualify for our funding, then they get extra case management to help them be successful, because it's a crack that we were kind of seeing. We're only doing the housing case management, but there needs to be mental health, there needs to be drug and alcohol case management to really make them become self-sustainable.
So are you seeing, say, like more older, like older individuals in the homeless population or younger? Like, do you look at, say, the demographics of who you find?
It's usually a mix. I would say the majority are between the ages of 24 and 50. I know it's a big age range, but it's we do have some traditional age, transitional age youth.
Mhm.
Um, there are, we have someone here that works specifically with them for their specific needs. But I think the majority is just that middle adulthood,
Hmm.
not so much middle age, but middle adulthood.
Okay. So you're not seeing lots of, say, like whole families
Oh no,
out
we
there.
yeah, they have families. Yes, a lot of them do have families. I think a lot of it has to do with, that's why we have somebody here working with the youth. I think a lot of it has to do with the generational poverty in the areas.
Hmm.
And that's why the case management is so important, because things that you think is common sense, as someone that grew up in poverty, I was never taught that. I had to learn that on my own. So, and having someone being able to tell them certain things really helps them, which you think would be common sense, but it's not. If you're not taught that, how would it be common sense?
Hmm. Yeah, so I guess so in those, yeah, so it's so it can be a challenge to try to transition them from homelessness back into a home.
Or just end that cycle because their homelessness started because they don't have that financial literacy, or they don't know how to conduct themselves in a job interview or in a specific place because they're used to their environment.
Mhm.
Um, so like getting them set up with career link and getting mock interviews and how to dress for an interview, or financial literacy on how to
Mhm.
save, and not just someone being like, you just have to save your money. No, that's hard when you're in poverty. It's not as simple as that. It's kind of teaching them financial literacy when it comes to what can you do if you're stuck in a bind, and not falling prey to predatory lending or getting deeper into a hole.
I do know, yes, there are lots of, lots of lower level service, food service jobs and social service agencies that are looking for individuals, but I guess, it can be, well, so it's even more compounded if they have a criminal record or,
Yep. And a lot of times, this is what I do as well. I send the referrals, but a lot of times I feel that I'm giving the most help by just brainstorming with them. When you're in the middle of a crisis, it's hard for you to think outside the box because you know you need all of these things, but there's so many things that you need that you can't put it in a straight line. And then you say, why don't you have a job? Well, this because of this, and this. And it's like, okay, well, let's deal with this first barrier. What can we do to stop that? And having them be able to deconstruct it with someone and come up with a plan. A lot of the people I see do self-resolve.
Mhm. Well, I'm sure. I guess it's a great feeling when you do have a success story and, you're able to,
Unfortunately for me, the only success that I know is that I know that it's happening is if they don't call me back.
oh,
So
okay.
I don't really see so much of the success stories unless they end up with the case managers and I see
Yeah.
them working through it. But I mean, sometimes I hear them and it's great.
Mhm. Okay. Okay, and so I guess so you have a lot. I guess yeah, I did visit you at your office that one day, and so basically, well, the purpose of this interview is hopefully just be able to give you more than a 30-second soundbite you would get on Channel 10.
Right.
So so I guess we'll look at the future. So I guess I'd be happy to interview you in the future when when new economic data comes in, and
Yep.
hopefully the pandemic will be behind us.
Yeah.
But unfortunately, yes, people are still getting sick from COVID, and but that's a whole other issue.
Yeah, I suspect that there's going to be a transition period from the help that came with the pandemic and it going away, a transitional period of people being able to get back onto their feet. Because I think the help that came during the pandemic was something that people needed despite COVID.
Okay.
And it kind of pulled them out of the poverty that they were in, even if they weren't
Yeah.
directly hit by COVID. But I think that with all of the agencies working together, I think we're going to make a real difference. But there's going to be a little transitioning period.
Yeah. And I guess still getting access to, say, medical insurance and adequate health care. I mean, that's another challenge.
Right.
So, I mean, that was helped by the pandemic and, like expanding Medicaid rolls.
Yeah.
So, I mean, but so they are able to access Medicaid and food stamps if they're in a shelter or.
Yes, you can apply there and you need an address to apply for food stamps. However, I know at the Blair County Assistance Office, I'm not sure about Cambria, that I've never dealt with that, but they are able to use the welfare offices or the public assistance office, their address in order to apply for food stamps until they get an address.
Okay. So do you ever see any issues related to, say, human trafficking in the area?
Yes. Sex trafficking is it's a big issue in Altoona because we are right in the middle. We're right in the middle of we're right off the
The railroad.
interstate.
Yeah.
Family Services just did a big coalition with that to raise awareness for that. We work closely with Family Services, the victim services, whenever we're dealing with a domestic violence client to get them over there for advocacy. And when we come across a case of sex trafficking, we do what we can on our end for the housing portion, and we make sure to report it to them. But sex trafficking is a big problem in Altoona that people don't realize.
Yes. Okay. Yeah. It's always a lot of very sad cases. So I do know, like with the housing projects in Johnstown, they start advertising, having people come from, say, New York or Philadelphia, where the housing projects might be overcrowded, and come here.
Yeah, we see that. It's a lot of transient. Um, and they come down here, they're given a lot of hope and they come down and don't realize that there's a wait for us as well. We don't have enough houses just to have people in the apartments. It's hard to find the housing. Um,
Yes.
and the shelter only has 30 beds. And we're trying to help everybody, but when they come down and they are promised all these jobs and
Yeah.
all this assistance, it's it's sad when they realize that it's just not possible to help you right away.
Yeah. Yeah. I understand. And so, I mean, of course, Johnstown, with the population decline we've had, yes, we do have lots of old dilapidated houses. And trying to get funding to either tear them down if they're eyesores, or recondition them and let people move in, and then, but, having, and then the other problem is finding jobs for them at a living wage.
Right. That's why a lot of if they're in Johnstown and are chronically homeless, they usually end up coming down to Blair County because of the job situation. A lot of them try to do that. It's just difficult when Johnstown doesn't have those resources for income, which Altoona does. We do have a lot of resources for income, and but it's the housing aspect of it. We don't have enough houses.
Yeah. Okay. Yeah. Well, I mean, certainly, yes. I mean, in some ways, the issues in both counties, then, in a sense, they're the same, but they're also different.
Yep.
So yes. Well, okay. Well, I guess that's all I have to That's all I had to cover for today. I mean, is there anything else you would like to discuss? Any other issues?
I don't think so. I think that pretty much covers it. Um, if you would have asked me a year ago, I would have had lots to say, but the the agencies around here and our new director have really made a good networking where we are really working together, and it feels like
Mhm.
we're heading in a really good direction. And we still have these issues, but we're coming up with things outside of traditional funding that again you have to ask for and beg for. But we're coming up with a lot of ways, and I do see a lot of people self-resolving. So I think that I'll get better.
Okay. Well, I want to thank you for your time, and well, I'm going to stop recording now.
Okay.